Hey everybody, welcome back to our channel. Today we are starting our Derm Mom series with my mom.
Hello.
Dr. Carla Fisher, who is a dermatologist. And we had you guys write in all of your questions and everything, so we're gonna go through and answer as many as possible. Let's talk skin. Okay, so jumping right into it.
I think we need...
Can I hang up?
Oh no, I want to answer that. Hi, Sue.
So what are the best products for aging skin? This is a very popular one that we got.
Well, aging skin involves quite a few different things. People get permanent freckles and discoloration, bumpiness to the skin, loss of fluid in the skin, and wrinkles. So we want to approach this in different ways.
Okay.
So tretinoin or retinol over the counter is a derivative of vitamin A, and it helps to reduce fine wrinkling in the skin. And it's also an acne treatment. So using just a tiny bit of that at night may be helpful in the long term for reducing the fine wrinkles from sun damage.
Okay.
The other thing that we sometimes use if people have a lot of discoloration is a hydroquinone, and that's a bleaching cream. There's other bleaching creams like kojic acid, azelaic acid, but hydroquinone's kind of my favorite. Over the counter, it's 2%. Prescription is 4. And then a lot of dermatology offices kind of have their own mixed up that are even stronger. So if somebody has a lot of discoloration, which are often people refer to as age spots or liver spots, but they're not, they're sun damage, a little hydroquinone will help too. I would say the most important thing is to use a good, strong SPF 30 sunscreen regularly. And I would suggest using one in a moisturizer because we all lose moisture. And so those two things will help you keep looking younger throughout your life. So
Sunscreen always, number one.
Yeah, no tanning except out of a can. The other thing that might be good for anti-aging is an antioxidant, something with vitamin C and E in it. And this would be a good morning cream to add to the sunscreen and moisturizer.
Nice. Okay. How do you get rid of dark under eye circles? Or just dark under eyes?
That's really a challenge, Jacqueline. But there are... Like I was talking about the bleaching creams, the hydroquinones, etc. They may be helpful to use under the eyes as well. Also, sometimes it's due to loss of volume under the eyes, and a little bit of filler like Juvederm or Restylane put under the eyes can lift that up and make that shadowing look less obvious. And then sometimes people get chemical peels or laser done. There's some home remedies, you know, getting enough sleep. Yeah, using some ice or an extra pillow at night so you're not so puffy. And also, you know, again, moisturize well and protect your eyes from the sun.
Sunscreen.
You got it.
Okay, perfect. This is a good one. How do you help with maskne? So acne that's caused from wearing a mask.
I've been seeing more of that.
Oh, I bet.
And it's probably heat and breathing inside your mask that stimulate that acne to come about. And actually your face isn't getting any light on it. So people are getting also that and irritant acne. We would treat acne the same. Okay, we use topical antibiotics, we use retinoids. Over the counter, there's adapalene, which is a retinoid, and that helps whiteheads and blackheads. We use prescription ones, of course, in our office. Then there's topical antibacterial type things, and over-the-counter benzoyl peroxide would do that pretty well. Which, by the way, be careful with that stuff. It bleaches fabric, so you don't want to ruin your clothes. And
It's a good
then,
tip. Hot tip.
Yeah, if you're having trouble after a couple months of using those and they don't work, then see a dermatologist. We've got lots of treatments.
How do you spot melanoma, which is a type of skin cancer?
Right, it's probably the deadliest, scariest skin cancer we treat. And even young people can get it. So it looks like a mole gone bad. So melanoma can arise in either normal skin or in a pre-existing mole. And we use our ABCs to help diagnose that.
She's taught me this from a young age.
So A stands for asymmetric. So if one half looks different from the other half, it's more worrisome. Okay, B is for borders. You want nice, smooth, round or oval shaped borders and not spiky or scallopy ones.
Got it.
C is for color. You would like a solid uniform color in the mole and not a mixture of like black and white or red and
color.
Brown. Yeah. D is diameter. They say if it's bigger than 6 millimeters, get it checked out. But honestly, I've seen melanomas even smaller. So that's about pencil eraser size.
Pencil eraser, okay.
And lastly is E for evolving, which I think is real important. Moles that are changing should be evaluated.
Check your moles.
Check your moles.
Okay, next question.
Can I say one more thing about that?
Yeah.
If you catch melanoma in its earliest stages and treat it properly, the cure rate is about 99%. It's amazing. If you wait too long and it goes to other parts of the body, you will almost certainly die from it. Scary.
Yeah,
Big
that is
difference.
scary.
So check them early and don't wait.
How to treat rosacea or inflammation in the face?
Okay, rosacea is a skin condition where people get redness and flushing and red bumps and pustules.
Okay.
So usually this is treated medically with topical antibiotics, topical things to kill the mites in our skin that we all have. And
Ew.
I know, ooh, but and sometimes antibiotics and other methods. Persistent redness is hard. There are medications that are prescription that could help with that. And probably the best treatment for the persistent redness is laser.
Okay.
We have vascular lasers that can treat both the background
And how long does that take?
redness,
One treatment, 2 treatments?
Oh, usually 2 or 3 or 4. I've heard that green tinted makeup helps counteract the red, but I'm no expert there. Topical treatment, I usually use a prescription called metronidazole to start, and it's a type of an antibiotic.
Okay.
So if you have rosacea, see your dermatologist. And some people have triggers, like hot drinks or alcohol or certain foods. And if you notice you have a trigger, you want to avoid that, and that may decrease.
It's like having an intolerance or an
getting the
allergic
redness.
reaction.
Yeah.
How do I prevent the bumps on the back of my arms and legs? Sounds like keratosis pilaris.
I think so. So keratosis pilaris is super common. Probably 80% of the population has it.
I have it.
And the good news is it usually kind of fades away in your 30s, so probably won't have it forever. It's a bit of a nuisance to try and get rid of because you have to stay consistent with the treatment. If you stop, it comes right back again.
So fun.
So you can use a little bit of retinoid, so the tretinoin, retinol on those areas to help exfoliate and get those plugs out of the pores. You can use a loofah. So it's one of the situations where I will suggest people use a loofah on the skin and then use a moisturizer with a little bit of acid in it so it can help exfoliate the skin. Something like amlactin or lachydrin, and just keep doing that.
Okay, and so what is keratosis pilaris?
It's a medical condition where the follicles get plugged by sebum and skin cells.
Okay.
And it feels rough, and sometimes it gets a little inflamed.
This seems like a very simplified question, but what is the most important skincare product?
Sunscreen.
I knew she was gonna say that. What's the second most important skincare product?
Moisturizer.
Moisturizer. I feel like I could have guessed that one too. But basically protect and hydrate your skin.
Yeah.
Best solution for redness.
Okay. There are some prescription medications like Rofay that you can put on in the morning, and they will kind of constrict your blood vessels on your face, and then you don't look so red. But the best is probably just to get laser.
And how many sessions of that?
2, 3, 4. It depends on the person and how much they have.
Is eye cream really worth it?
Well, the eyes have the thinnest skin on the body, and they're the most sensitive. So first of all, you want to be careful that you can tolerate that. I usually suggest applying a new cream on your inside of your wrist twice a day for a week, and if you don't get a reaction there, I think it would be safe to try it on the face. So we really need some good moisturizing there. So some hyaluronic acids in the moisturizers is a superb idea.
For eye creams?
For eye creams.
So are eye creams worth it?
I think eye cream is worth it because a lot of the creams are formulated to be more gentle.
Perfect. Psoriasis tips if you don't want to be on steroids.
Psoriasis is a disease where it can be very disfiguring, and people can get big red scaly plaques anywhere on their body, and they can get arthritis with it. Nowadays we have so many treatments for psoriasis that we never used to 5-10 years ago.
Awesome.
It is so exciting. It used to be that if we got somebody 80% cleared, we considered that a home run. Okay, now we can sometimes get people 100% clear and keep them that way, and stop the progression of the arthritis. So mainly see your dermatologist, because we have lots of safe, effective
Are they most
treatments
topicals
now.
or lasers or?
We have a variety of topicals, we have lasers, we have light treatments, but we also have oral medications that reduce inflammation, and we have several biologics that treat very specific molecules that cause the psoriasis in the skin. Yeah, it's
Interesting.
amazing.
What is your opinion on retinol?
Oh, I think it's great. Retinol is a milder form of tretinoin or retin-A, and you can get it over the counter.
And what is it for? What would you recommend it for?
It's mainly marketed to treat anti-aging and fine wrinkles.
Okay, so how often would you put it on?
I would do it nightly because it can make you a little bit more sensitive to the sun. And don't use it if you're pregnant or nursing.
Good to know. Okay, here's a quick question. Are you supposed to pop your pimples or no?
No! That just spreads inflammation throughout your skin.
You heard it here. Derm Mom says no popping pimples.
No popping.
What about blackheads?
Use the Retinol, and that helps to debride the pores. Now you have to use these things for quite some time, months, for them to work. Okay. Eye roll.
Best products for hyperpigmentation and scarring.
Okay, so hyperpigmentation and scarring are two different things. Sometimes you have both. The hyperpigmentation, you use the bleaching creams. My favorite is the hydroquinone, okay, which over the counter is 2%, and prescription is higher, okay. There's also bleaching creams that have azelaic acid and kojic acid. I don't think they're as strong, but they can be helpful too. Also, sunscreen.
Always.
Okay. There's a lot of scarring products right now over the counter that you either paint on or apply. One of my favorites is called New Gel, and it's just a sheet of silicone, and you stick it on there and it applies pressure to the wound and makes the scar smaller. There are also many fine laser treatments for scarring.
Okay. Medical grade versus not medical grade skincare.
Okay, we have a lot of products in our office for both cosmetic skincare and diseases. I do like a lot of the products that we sell that people
Are they
can't get
medical
else.
grade?
Yes.
Okay.
So, prescription things like the tretinoin or the retin-A are going to be stronger than what you get at the stores. Our eczema patients may be quite sensitive to over-the-counter moisturizers, and we can provide ones that they can't get elsewhere that tend to be helpful.
Is sunscreen safe to use, and what's the difference between chemical versus mineral sunscreen?
Sunscreen is safe to use. The chemical sunscreens get absorbed into the skin and they work like a sponge to soak up the sun rays. Physical sunscreens are like titanium oxide or zinc oxide. They're more pasty and
Those are the
hard to
mineral
put,
ones?
Yeah, they're harder to put on, but they act like a barrier and they bounce the light away. Some of the chemical sunscreens have been found to be in small quantities in breast milk, and there have never been any ill effects found from this absorption. And the FDA is looking at this more closely, which I think we should do, but it seems to be safe. If you're concerned, you can just use the physical sunscreen. Yeah, the mineral sunscreens, the ones that just have titanium and zinc in them and not the other chemicals. And then you don't have that concern.
Good to know. Okay, this one's been talked about a lot. What is the correlation between what you eat, so your diet, versus acne in your skin?
Okay, scientists have argued over this for years, but it does seem that if you increase the inflammation in your body, you increase the inflammation in your skin. So milk products, dairy can increase that inflammation, that glycemic index. So I usually suggest to my patients to skip dairy as much as they can. And also high fat foods will increase that glycemic index as well. So avoid the high fat, high sugar diets. It might be helpful to use some supplements. Research is kind of hinting to using niacinamide or zinc.
How often, and what's the overall direction you would give somebody to wash their face?
Wash your face a couple times a day, but especially after exercising or breaking a sweat.
Okay, and how should we be washing our face?
I would just use your fingertips and gentle cleansers, no harsh, gritty cleansers, and no loofah or rough products. Be gentle.
What should we not be using on our face?
I think you'd be hard put to find a dermatologist that recommends toner.
Really?
Yeah, it's just drying and alcohol based, and
So no toner.
no toner.
Okay, do collagen supplements actually work?
There's some evidence that hint towards that it helps in wound healing and anti-aging.
And what's too young to get Botox? Like, what age do you think you should be getting Botox?
Well, I have patients that come in and they want the preventative. I would suggest don't get Botox until you have some wrinkles so we know where to inject it.